Mohs surgery is a highly specialized surgery that we use for the treatment of certain types of skin cancer. It allows us to treat the skin cancer, remove the skin cancer, and with a high degree of certainty, and have a very high cure rate, well above 95%, and also allows us to leave behind the smallest scar so that we can treat the skin cancer and prevent any sort of deformity. The three most common ways that we treat skin cancer are using standard excisions, radiation, or Mohs surgery. Standard excision is a very good option for a large number of skin cancers. It's where we look at the skin cancer, measure a standard margin around the skin cancer based on research, and remove that. It has a very high cure rate, and it's very good for areas where we're not too concerned about scarring. Radiation can also be good treatment for skin cancer. The problem with radiation is the cure rate is not quite as high. It tends to have a large number of treatments, anywhere from 8 to 10 treatments. And it's a good option for patients that for some reason can't tolerate surgery, just do not want surgery, or sometimes patients may have other medical comorbidities that may make surgery difficult or not the best option. Mohs surgery, which is really usually the best treatment for skin cancers that occur on their head or neck, because these are areas that are very cosmetically sensitive. And it's also very useful for other areas of the body when the skin cancer may be very large or very long-standing, or it may be a complex skin cancer that has come back after other treatments, or in patients that have other diseases that make skin cancer more aggressive. You can really treat all of the most common skin cancers with Mohs surgery. The most common skin cancer is basal cell carcinoma. The three most common are basal cell carcinoma, squamous cell carcinoma, and melanoma. And these actually can all be treated with Mohs surgery. There are a number of other skin cancers that people don't really hear about so often, that are more rare. Some of them can even be a little bit more aggressive than melanoma, and those also have very high cure rates when they're treated with Mohs surgery. Mohs surgery, we always tell our patients to really plan on being in the clinic for most of the day. It doesn't usually take quite that long, but it is a process that has some areas that are a little bit unpredictable. The way it works is you'll come into the clinic, and typically you've had a consultation with me before the procedure, so we've told you what to bring and how to prepare. Based on how much skin cancer we find or whether we find any additional skin cancer, the length of the day can be longer. Probably the minimum is maybe 2 hours. Occasionally, very rarely, with very large skin cancers, it may even actually stretch over 1 or 2 days. It just really depends on the size.